I think, well, Medicare is extremely important. I think that it's a position or a philosophy we should stand on, utterly stand up for, and I think it's probably the greatest cultural asset, the single greatest cultural asset that we have. There's nothing, in my opinion, more important than the humanitarian aspect of caring for each other.
That our healthcare system doesn't belong to the BC Liberals. Our healthcare system belongs to British Columbians of this generation and future generations in our province.
Medicare is a very important privilege that we all have as Canadian citizens, and I think it's one of those things that all too often many of us take for granted until we actually need it.
I'm almost 91. Have you seen a list of the government employees cutting anything at all? No. They gave themselves a huge salary raise, and we let them.
What's going on with the healthcare system? Well, on the very bottom line, like underneath all of the cutbacks and all of the uproar about we need more money here or there, is the fact that the Canadian governments, I'm talking about Alberta governments, BC government, the federal government, would really love to see private health care. They would very much like to see the places that they invest in make money off of our ill health. And that's the very bottom groundwork of what's going on.
There we go. Hold the sign up there. There's the other side here. We're going to sing a little song right now. I don't know why you hate us like you do. I don't know why, but you do. I don't know why you can't get it right. I don't know why, but you don't. You never seem to want our attention. Just promises, promises at election. I don't know why you hate us like you do. I don't know why, but you do. We cannot bear your cuts to health care. We cannot bear what you do. We cannot bear a long waiting list. Private health care we resist. We'll tell you what we all desire. Just don't set our health care on fire. I don't know why you hate us like you do. I don't know why, but you do.
We sponsored this event, the BC Health Coalition sponsored this event because we were approached by a group on Salt Spring Island called Save Our Surgeries. They're very passionate about the issues that they've been facing there on Salt Spring Island, and we realized that in fact their issues aren't unique, that we are seeing these cutbacks and broken promises from across Vancouver Island. And we decided as an umbrella group of the BC Health Coalition that we would help bring together activists from across Vancouver Island to bring their message to the steps of the legislature today.
Thanks for coming today. I know there's a lot of communities other than Salt Spring affected by these cuts, these very deceitful cuts, and people have come a long way today. It's not a gentle day, but crowd together and keep one another warm. I was asked to speak because Salt Spring's operating room is now sitting empty. This is an operating room that not only provincial taxpayers but local taxpayers and our local hospital foundation spent millions of dollars building a brand new state-of-the-art operating room in the Lady Minto Hospital on Salt Spring. That was 5 years ago. 5 years ago, the Vancouver Island Health Authority came to the CRD board, and I was Salt Spring's representative on that board. They came to the board saying, this is our top priority for healthcare on Salt Spring Island, is to upgrade your hospital and to build this new operating facilities. 5 years later, it sits empty with no surgeon. I ran in the provincial election. I was obviously unsuccessful. It was one of the most deceitful elections I've ever witnessed in British Columbia. Our MLA and the health authority were telling us before the election that their priority was to get a surgeon to reopen the operating room. Now, after the election, they're telling us that we need to do a needs assessment. That maybe there's other priorities that Salt Spring has for healthcare, and this is the same entity, this is the same health authority that came to the CRD board just 5 years ago telling us that this was their top funding priority. So we put millions of dollars into that facility. Regional taxpayers, everyone who lives in the Capital Regional District contributed to that facility on Salt Spring, and it's sitting empty. There are other speakers, and I want to move things on here, but I just want to say something about the funding and the cuts being made to healthcare. The Vancouver Island Health Authority shortfall of $45 million represents 1/10 of 1% of the entire provincial budget. It's a rounding error. So not only is the closure of this facility, the closure of other facilities in the province, not only is it deceitful, but it's completely unnecessary. Don't let anyone tell you that we do not have the financial capacity to deliver health care to seniors and other residents of this province. It's nonsense. So
healthcare in Campbell River is deteriorating all the time. Our hospital has been chronically underfunded, and we now have a pending crisis with our ICU because VIHA no longer funds locums. VIHA is looking to some other funding area for it. They should have been acting on it 3 months ago when they found out in January we were going to be having a pending crisis with the loss of one of the doctors who works in ICU. But VIHA is a problem. You cannot micromanage a hospital in Campbell River from Victoria. We do not have a local administrator. We do not have a local hospital board. And this is a major problem since we lost an administrator and a local board.
I think if Gordon Campbell cared about public health care, he would be making very different decisions for the citizens of British Columbia. I think he would not be cutting seniors programs that keep them in their homes and healthier for longer. He would not be proposing public-private partnerships for our medical facilities, and he certainly wouldn't be supporting the existence of private for-profit clinics across the province. So no, I don't think that Gordon Campbell supports public health care, and I think the sooner that he listens to what the citizens actually want, the better the direction of the province will go.
I am a nurse, and I've been a nurse for over 20 years. And I've been at the James Bay Community Project for 5 years. I've just recently graduated as a nurse practitioner just in September here. So James Bay Community Project is a primary health care facility, and this has been in operation for over almost 35 years. What this means is it's not for profit. It is board operated, community involved. And what we do there is we look after some of the most frail and marginalized people in the city, and that is through the ministry's own statistics. So we look after 2,650 people in an interdisciplinary team format model. And this is celebrated around the world as being the model of healthcare. It's called primary health care. And that is nurses, nurse practitioners, and physicians, all salaried, all working together and looking after the healthcare needs of some of the most frailest and elderly and marginalized in the community. So what I'd like to say today is this is wrong. We are going to be closing as a primary healthcare unit. And what happened was, like many of you out there, I'm also a casualty of these health cuts. I will be looking for work. There is no longer going to be a nurse at the facility, and that has set up a domino effect. With my position, the whole community clinic as a healthcare clinic is going to close. So this is wrong. So there is a few answers here too. I stand among 59 colleagues who are nurse practitioners in the community and in BC. We have been educated in BC. Part of your taxpayers' money helped to help my education. And we are standing here ready, able, poised, educated to take on healthcare needs like at the James Bay Community Project, but also the 400,000 population of British Columbians that have no access to a primary healthcare provider. There's many of you in here today that have no access to get in other than a walk-in or an ER, and we all know what kind of healthcare we get from them. So this again is wrong. There's 68 of my colleagues going to be coming out in the next year. We are not able to take on patients. I have people here coming up to me and saying, can I be your patient? And I'm saying no, unless this government comes up with some funding formulas that work, that we can provide care along with the established primary healthcare providers out there. There is a need, and I think that we provide one of the answers. So I think James Bay is a canary in the mine, and we're going down, and I think the mine is full of some real foul air, and that's our healthcare system. Thank you.
I've come down from Parksville on the bus. I am a disabled person. It was rather a hassle to come down here, but to me it's extremely important that we have the same healthcare system that was envisaged by Tommy Douglas. And the private for-profit healthcare is eroding the taxpayers' money, and it is basically selling future generations down the tube, and we can't afford to do that. And especially for people with disabilities, they're already not having their needs met, and that's already before becoming a senior citizen. So we have to have a healthcare system that is fair to everybody, and not just for those who can afford to pay to get their needs met.
I think the current government has decided that as a political decision that the direction that they would like to take our public healthcare system is away from being in the business of healthcare. You know, they would like healthcare to become an actual business where the private sector picks up where they left off. So choosing to do a number of things, to make the cuts where they're making, is creating a pressure cooker type situation in the province in terms of healthcare, where only the market can sweep in and help us. So certainly I think that they're actively engaged in creating the crisis, when we all know that the money is there for public healthcare, to fund services and facilities in the way that we need them to be for all citizens regardless of their ability to pay.
So Oak Bay Lodge and Mount Tommy Hospital are a very good example of what happens when funding shortfalls for capital funding happen to healthcare. The Island Health Authority is being forced by the funding shortfalls to sell off these valuable properties that were given for future generations in order to finance their short-term operational costs. This is so short-sighted, it's so economically stupid that it's breathtaking. This government cut taxes during a boom time when we had no need of economic stimulus. They sold off public assets like BC Rail. They failed to set aside money for a rainy day, and now they are crying emergency and selling off our public assets again. It is naturally a zero-sum game. No business person in their right mind would sell their assets and lower their net worth, not unless they wanted to destroy the very foundations of their own wealth. But that is exactly what the Liberal government is doing. In my work as a founder of lands, I've seen these tactics over and over again, and I see them happening with Oak Bay Lodge and Mount Tommy Hospital. And I have a personal investment in this because Oak Bay Lodge is in my community and my mom lives there. And that means that I can visit her every day. She's close to my house. And that's how it should be to everybody in this province. That our elders age inside their community with the people who they love, running in and out to say hi for 10 minutes. It should not be that they're way in the distance. So the pattern is like this. First, you undermine confidence in perfectly sound buildings, often buildings that have been freshly renovated. Then you redirect seniors to other facilities to try to make it look like the buildings aren't really being used very much. And then you sell the property, and that undermines confidence in public health care. It's a pattern we see over and over again. And what happens when the privatization happens is the seniors end up in acute care beds at $1,200 a day. And who wants to be in an acute care hospital every day for months and months? It's a no fun place to be. People should be receiving the warm, loving, nurturing care that they're getting right now in the public care of Mount Homie Hospital and Oak Bay Lodge. Universal health care is a cornerstone of our society, our economy, and our democracy. Like public education, it provides a powerful platform and stabilizer on which we can build our lives, our businesses, and our future. And like public education, we see it being starved. These lands and these hospitals belong to future generations, beyond our ability to foretell. The sacred trust of public health care belongs to future generations. The lands and the health care both belong to the future. They belong to our great, great, great grandchildren. They are not ours to sell.
The pending privatization of Oak Bay Lodge is a real tragedy. Oak Bay Lodge is a facility that houses nearly 300 senior residents, people who have a variety of special needs, long established in the community, and without any kind of consultation in the last month or so, the Vancouver Island Health Authority, on the direction of the Liberal government, have announced they want to privatize it. Oak Bay Lodge is currently operated by a society, the Oak Bay Lodge Society. It's well represented by members of the community. It's well thought of in the community. It's a bit of an icon in Oak Bay. It's been around since the mid-1970s. About 270 people work there. They care deeply for the residents that call it home. And unfortunately, we don't know what the future is going to bring for the facility. It appears that if the facility is privatized, residents may be forced to move. They may be forced to move anywhere in the Capital Regional District. It's not entirely clear if there's a location that the new facility might be built, or if and when those new beds would be built. It almost guarantees another 3 or 4 years of uncertainty for people who currently call Oak Bay Lodge home.
On the surface, we're seeing cutbacks. BC is having an overrun on the Olympic expenditures, though they insist they're not. And there's been a certain amount of things built, like highways and so on, that demand a lot of money. And so the easiest and most vulnerable place to take the money from is, of course, the healthcare system. Ill people have a hard time spending a lot of time complaining, writing letters, knocking on their representatives' doors. And so it's an easy target.
I don't need 2 minutes. I can do it in 2 seconds. The problem is the Gordon Campbell government. Now, I'm not joking about that. This is National Medicare Week. And in many ways, what we really celebrate this week are the 5 principles outlined in the Canada Health Act: public administration, comprehensiveness, universality, portability, and accessibility. These are the principles that help Canadians define who we are. And of course, it is the role of the provincial government to provide healthcare funding that enables the healthcare system envisioned in those 5 principles.
I believe that there's an element of the system being undermined so that by privatization, because if you starve the system long enough, then people are going to say, okay, you win, the public system is not working properly, and therefore we'll save our money up and we'll go toward what the American system's like now, and we'll pay money out for private care.
Public health care is by far more efficient and cost effective than the private system. Studies across the world will show that. In fact, you would be hard pressed to find a private system which would reflect a more cost effective nature than a public system.
Now, back to Oceanside. You know, we're a community of 30,000 people. We include the community with the oldest population in Canada, Qualicum Beach, and the 4th oldest population in Canada, Parksville. Yet, we have no hospital. We don't even have a health care center. Now, how does that possibly meet the principle of accessibility? It doesn't. I agree, it doesn't. But we're told that maybe there is some good news. There have been newspaper stories recently quoting our MLA, Ron Cantillon. Ron, I don't know if you're here this afternoon. Oh, no, I'm afraid he isn't. Anyway, Ron has been telling us that a new facility for the area is a go. However, you know, I remember that old saying, the devil is in the details. We have not heard one word about what services this healthcare center will provide, only that it's a go. Gets a good headline, doesn't it? So what services might be available? Will it be a first aid station? Will it be a kind of extended after-hours walking clinic? Will it have any urgent care facilities? Will it be a hospital? We don't know if it will even begin to approach adherence to the principles of comprehensiveness. And what about the principle of public administration? Yes. I think we all know that both our national and provincial governments are committed to a deeper and deeper integration of Canadian business, military, culture, and indeed our entire way of life with that of the United States.
Our system is being privatized because there's a number of corporations in Canada and the States that would love to make a profit off healthcare, and so they'd like to set up clinics, and they'd like to make money off the ill people, and that is not, in our opinion, is not right. For people should not have to pay money, especially since we have a Medicare system in Canada, a National Medicare Act, to access proper health care.
British Columbia has the highest density of private for-profit clinics in the country. It's certainly an issue for us. It's been an issue for some time. It started and is sort of highlighted by the largest private clinic in Vancouver, being run by former CMA, or Canadian Medical Association, President Dr. Brian Day, which has currently become a very peak issue, as he's now launched a lawsuit against the provincial government in BC to try to find our legislation, our healthcare legislation, unconstitutional. This would allow private insurance to be purchased to access what are now considered medically necessary services, and which are paid for and covered under our medical services plan. So these private clinics have come together to actually challenge our legislation in BC and hopefully, in their mind, break it, so that what they could allow is a US-style private health insurance industry to come in and create a very true two-tiered US-style healthcare system here in BC.
Now, I remember it's about a year or so ago that Don Koopman was quoted as having expressed interest in building one of his private clinics in Oceanside. Even though the American example of private facilities funding shows what can only be called profiteering, that results in 20 to 30% overhead and profit for owners, with the record of this government, I'm concerned that this will be one of those very large devils in the detail. And so, when we finally have these details announced, and I predict it may be around 4:30 on the afternoon of Christmas Eve, it's going to be our task as a community to assess them against the principles of the Canada Health Act for comprehensiveness, accessibility, and especially for public administration. This new facility must not be private.
As you know, Comox area, Comox, Campbell River area, declined that regional board to go with a P3 to replace their 2 hospitals. And they won that one because they stood firm, which is what we should have done in the CRD. So good on them. It'll be interesting though, because as soon as they got into power, the Liberals, in 2002, they froze all capital funding because they knew what they were, and then they set up Partnerships BC, which literally hands over the construction of any project over $20 million to the private sector.
We and the other North Island people are fighting to keep healthcare public, and we are against the disastrous funding cuts that are announced by VIHA and the Liberal government. Our hospital and necessary medical services and preventative community services budgets have been slashed up in Campbell River. Right here, I'll hold up, get Joanne to here, hold up the headlines here. These are in our local papers and in the island papers, and I'll just read off a couple of them. Funding cuts may flatline intensive care unit. Surgeries canceled at Campbell River Hospital. Non-profits bleeding from small cuts, and that's in regards to the crisis center cancellations in Campbell River and all over the island, which is disgusting. Healthcare budget crunch impacts hospital. This is language that describes destruction and pain caused by VIHA's crisis management approach to healthcare and the Liberal government's failure to protect public healthcare. Now, I don't find fault with the doctors and the nurses and the hospital personnel, because they're doing all they can with the resources that they have. But I do blame VIHA for their chronic underfunding, short-sighted planning, and as our local orthopedic surgeon, Dr. Sommer, said in our newspaper, he said there's a disconnection between our hospital's operations and VIHA's management in Victoria. So it appears that neither VIHA nor the provincial government are acting on our concerns. People's lives are at risk due to their scattergun approach to healthcare and healthcare management. And what to do? Well, we polled of some of our people around the North Island. Here's a 4-point plan for the Liberals to enact or the opposition to fight for. Immediately restore adequate funding for all healthcare in BC, including providing money for needed new facilities and services. Eliminate VIHA and all the BC health authorities. And bring back some kind of a locally accountable hospital board or some other governance model to more adequately fund and advocate for our health services in our communities. Number 3, halt the further privatization of our healthcare system by calling for closure of clinics that are allowing privately financed purchase of core medical services, which clearly violates the Medicare Act. And finally, eliminate this public-private partnership P3 model for funding for new healthcare facilities. It's not accountable and it's too expensive. One last thing, Gordon Campbell, you know, he promised healthcare core services would not be cut during the recent election campaign, though the Liberals knew damn well that they would have to restrain their spending budgets earlier this year. Following the election, $360 million was cut from the health authority budgets on BC. Now, this funding has been reallocated by the Liberal government to cover cost overruns incurred by hospital, including P3 hospitals, other P3 funded projects, Winter Olympics projects. And I want to close here by restating the headlines above a recent Paul Willock's article on our local paper, and it's right on there. No one voted for worsening health care, and by myself as saying this Liberal government, enough broken promises, enough is enough.
New concept of who we think we are, and that we care for each other in a community spirit, a community sense. And I think when you lose that, you really fall into a dark abyss here where the objectives are not for the welfare of the people. They're for some very unusual, narrow slice of the population, less than 1%, owning such a huge, vast amount of the currency and the assets in the countries.
There's a reason that public is in the name of healthcare. It's a public healthcare system that needs to be there for everyone in our province and our country. You know, I remember standing in front of this legislature last year. You'll all remember the couch and lodge. We stood here with seniors and families, and we still have signs that remember couch and lodge. And I'll never forget The senior citizen who was here in his wheelchair and who motioned me over, and I went over to speak to him, and I bent down, and he was wearing his war medals, and he said, "I want to say I'm sorry, Carol." I said, "Sorry for what?" He said, "I'm sorry I didn't polish them up. But I don't come out and protest very often. But I'm out here not because of me. I'm out here because of other families who shouldn't have to go through what my families had to go through at Cowichan Lodge." In a province like British Columbia, those supports should be there for senior citizens in their communities. They have the right to have that kind of support. These are people who built British Columbia. And when we take a look at the kind of cuts, and other speakers have said it, did you hear Gordon Campbell promise to cut health care during the election? No. No, in fact, he said he was going to protect health care. And after the election, a completely different story. We see cuts in supports across British Columbia, including Vancouver Island. I want to say that I'm a proud member of the James Bay Community Project. That's my health care. That's provided quality health care for me and my family for over years. That saves money in the healthcare system by providing doctors and nurse practitioners and a mix of providers. That saves money in our healthcare system. It's a model of excellence. Why are we cutting a program that saves money and provides good quality healthcare? The government's going in the wrong direction.
The new patient tower at the Royal Jubilee Hospital is being built to replace a number of old parts of the hospital. It will be 8 stories high. It'll have 500 beds, 80 of which are psychiatric. The problem with it is it's not being built by the public. It's being built largely with private funds through a consortium which has been in the process of designing, building, maintaining, and then operating for 30 years, a contract which the provincial government, you and I, through the provincial government, will be paying them. And of course, they have to make a profit. At the same time, they came to the residents of the CRD and asked for $108 million toward this new patient tower. I appeared before the CRD as a former CRD director and asked them, urged them not to approve it because of the P3 implication. Unfortunately, they went along with it. So this patient tower is being funded by the taxpayers of the CRD and the provincial government on a 30-year contractual basis, which includes a large, lovely profit for the consortium. The experience with these P3s everywhere in the world, including in Abbotsford, which was the first big P3, is there's cost overruns, the quality of the construction is poorer than when it's done by the public, and we have this 30-year contract hanging over our heads. I will be dead before this contract is finished. My children and my grandchildren will be paying for it, and we are not going to get the same quality of anything in this new tower, and it's a disgrace.
The private clinic lawsuit that's been brought against the provincial government is very much about private insurance. This isn't what Brian Day would say is about access for patients. It's actually about access to patients' pocketbooks. This is about looking at patients as commodities and having the wealthy, access to the wealthy, and so being able to purchase private insurance, to jump the queue in the public system and to gain the ability to have the services they need quicker, faster, because they can afford it, while the rest of us wait in longer lineups in a public system which is decimated.
This is a critical moment for public health care in British Columbia. Before the election in March, I said, Carol said, that there was a shortfall in the Vancouver Island Health Authority. Mr. Abbott, who was Minister of Health at the time, Mr. Campbell, who was Premier at the time, Mr. Waldner, who was President of the Health Authority at the time, specifically denied that. They've cut surgeries, they've cut MRIs, they've cut senior services, they've cut long-term care, they've cut home care and home support, and finally, and most dramatically, they've cut mental health services on Vancouver Island. We have, and Salt Spring, we have now a situation in Vancouver Island where officials of this health authority say that you have to be much sicker to get access to mental health care in our communities. This is wrong. It offends us as a society. It's stupid from an economic perspective, and we have to fight it. And that's why I thank you so much for being here today, because this is a critical moment and we've got to fight it together. The solutions that make our healthcare system better are in the public system. And if we fight and defend our public healthcare system, we can find those solutions together in the coming years, not by tearing it apart, not by selling off places in our wait times to the highest bidder, but by improving public health care, by using nurse practitioners, by supporting community clinics, by providing care, appropriate care for the seniors we need. That's what we need to do.
What Dr. Day and other private for-profit clinic owners and operators would like is for us to be able to have two options of insurance. The wealthy could purchase, we would all have public insurance, and then the wealthy would be able to purchase additional insurance, which would allow them, like I said, to jump the queue, whatever public waiting line they may be in for whatever medically necessary public insurance paid for service, and access it at a private clinic faster and for an amount of money that would be covered by their private insurance. So very much like what we see in the US right now, where people can purchase private insurance and only in that way are covered. Those that have the money can go and access things as they need it. The rest of them sort of piecemeal, get what they can. In Canada, what it would mean is that we already have a shortage of doctors, nurses, and nurse practitioners that would then be pulled into a public system. So our wait lines would grow longer, and those of us that don't have the option to purchase that insurance would then be left with this system that, you know, is again piecemeal, and it's only going to serve, you know, us at so much more of a slower rate and a much more reduced capacity.
This year, if you don't know, marks the 25th anniversary of the Canada Health Act, which, as we have said many times today, is the foundation of our universal public health care system. The CHA was passed unanimously by Parliament, which was a remarkable collaborative effort with the NDP's Bill Blakey working closely with the Trudeau Liberal government and Health Minister Monique Begin to ensure that quality care would be available to everyone, irrespective of their financial status. Now, 25 years later, the CHA is under attack, and the Conservative government, as well as the Liberal government, is just standing by and doing nothing. Just one example of this occurred just last week when Canadians were outraged to learn that private clinics in Toronto and Vancouver were providing a queue jumping service to the rich for the H1N1 vaccine. This access by wealth is just one more example of creeping privatization and a government that refuses to stop it. New Democrats, clearly both federally and provincially, along with the Canadian Health Coalition and concerned citizens everywhere, will continue to fight against two-tier healthcare and the erosion of the Canada Health Act, as we have for 25 years. No one can demonstrate that for-profit will result in better healthcare. Today, we not only recognize the importance of the Act, but Canada's fierce commitment to Tommy Douglas's dream for Medicare.
The lawsuit was filed about a year ago. And is only now coming to the point where the courts are being able to determine how we will proceed. It should also be noted that Dr. Brian Day filed this lawsuit directly after the Medical Services Commission, which is the arm of our provincial government overseeing our provincial healthcare legislation, attempted to conduct an audit of his clinics. They had received numerous complaints from patients who had been double billed or charged twice, and other potential unlawful billing practices taking place at his clinics. They submitted complaints to the Medical Services Commission, which then triggered an audit of his clinics. They went to audit his clinics, and he wouldn't allow them inside. And very soon after, launched a lawsuit against the provincial government, claiming that the healthcare legislation under which he's practicing, he believes is unconstitutional, and so should have the right to charge as he sees fit.
The provincial government appears to be running down the system in order to make the argument that it's better off to be privatized. We've seen that in many circumstances where the province has not put in the investment into maintaining the facility or assets. So it's one of the examples and one of the reasons why they advocate for the privatization of Oak Bay Lodge. They say, well, the facility needs to be updated. Well, they're responsible for updating the capital costs of the facility because they haven't put the money in to maintain the facility. It doesn't mean that we should lose an important public asset.
Healthcare, I think, and I'm proud to say it, is one of the identifying factors of Canadians. And what does it really mean? Well, it means we care about other people, not just ourselves. And it just flies in the face of this personhood concept that comes out of the States and a lot of Western nations. This idea that it's all about the individual. When really, look what we can achieve with Medicare.
I mean, it's a U.S. way of creating problems. And we more and more are underneath the umbrella of the United States, which is very sad. I mean, I moved here from the United States in 1970 for very good reasons. And Canada presented some very fine solutions to how to help people live productive and good lives.
We have a system in Canada that is world-renowned, providing healthcare in a completely affordable fashion to all of our citizens, regardless of their ability to pay, protected by a Canadian Health Act, which allows you to travel through the country and still be provided with the same level of care. It's something that we're consistently proud of as Canadians and that we need to fight to protect and expand.
Welcome to British Columbia. This is the best place to be, but only if you're Gordon Campbell or one of his rich coterie. Mother Nature has blessed us with glory, but there are other sides to our story. 'Cause scenery isn't the best thing to eat when you're having trouble to make both ends meet. Welcome to British Columbia. This is the best place to be, but only if you're Gordon Campbell or one of his rich coterie. What we got to sell, no one's buying, and even the salmon are dying. We sold off our railroads, the forestry's gone. We could sell you a river, but they won't last long. Welcome to British Columbia. This is the best place to be, but only if you're Gordon Campbell or one of his rich coterie.
Thank you, thank you, thank you. And let's all work.